There's a moment that happens in the middle of the night that most people never talk about. It's 2:47 in the morning. An 81-year-old man named Harold gets up from bed, same as he's done thousands of times before, to use the bathroom. He's done it last night, the night before. He knows the room. He knows the distance. His eyes are barely open, but he doesn't need them to be. Except this time, something's different. Maybe his foot catches the edge of the rug. Maybe his knee doesn't respond the way it used to. Maybe for just one fraction of a second, his balance shifts in a direction his body can no longer correct fast enough. One small wobble, one misstep, one fall. And here's what I want you to understand, because I've seen this play out more times than I'd like to count. The fall itself isn't always what changes everything. It's what comes after. The broken hip, the hospital stay, the surgery, the weeks in a rehab facility away from home, the fear that settles in quietly and deeply the moment a person realizes their own body surprised them. A lot of seniors stop walking confidently after a fall. They start shuffling. They hold on to walls. They avoid the stairs. They stop going out to the grocery store, to church, to the grandkids' baseball games, not because they physically can't, but because the fear of falling again is simply too heavy. That's what a fall can cost. Not just bones, independence, confidence, life. Now, I'm not telling you this to frighten you. I'm telling you this because I want you to understand why what I'm about to share with you genuinely matters. What if just a few minutes of simple movement each day, movement you can do right there in your living room, holding onto a chair, could help your body stay steadier, stronger, more confident on your feet, even in your 70s, 80s, or beyond? Today, I'm going to walk you through 4 exercises that target exactly the systems your body needs to stay upright and balanced. And I'd ask you to stay with me until the very end, because the 4th one, a side leg raise that targets hip strength, is something many physical therapists quietly consider one of the most important balance exercises for older adults. And yet, most seniors have never been shown it. Let me take just a minute to explain what's actually happening in the body as we age, because once you understand it, these exercises will make a lot more sense. Balance isn't just one thing, it's a system. Your brain, your muscles, your inner ear, your joints, your eyes, they're all talking to each other constantly, making tiny adjustments you never consciously notice. When you're 35, that system runs like a well-tuned orchestra. Everybody comes in right on cue. As the decades go by, that coordination starts to lag. Muscles shrink. Doctors call it sarcopenia, and it begins in your 40s, picking up speed as you get older. Nerve signals slow down a little. Your inner ear, which helps tell your brain which direction is down, becomes a bit less sharp. Vision changes, reaction times, the amount of time between when your brain notices a problem and when your body actually does something about it, that slows too. The result is that when your foot catches that rug at 2:47 in the morning, the correction that used to happen automatically, before you even knew you needed it, just doesn't come fast enough. The good news, and I mean genuinely good news, is that muscle can be rebuilt at any age. Balance can be trained. The nervous system responds to practice. The research on this is quite clear. You are not simply at the mercy of time here. So, let's talk about what you can actually do about it. The first exercise is called the heel-to-toe walk. You may have seen a version of this used in roadside sobriety checks, which I realize is not the most flattering comparison. But it's used there precisely because it's such an honest test of balance. Here's what it improves: coordination between your legs, your core, and your brain's sense of where your body is in space. Physical therapists use it to retrain what's called dynamic balance, the kind you need when you're actually moving, not just standing still. To do it safely, stand next to a wall or your kitchen counter. You want something within arm's reach, just in case. Now place the heel of your right foot directly in front of the toes of your left foot, so they're touching, heel to toe. Then take a slow, deliberate step forward with your left foot and place that heel directly in front of the right toes. Keep going for 10 steps. Turn around and come back. That's one set. Do 2 or 3 sets and aim for this 3 to 4 times a week. Now, there are a few common mistakes I want to mention. First, people rush it. This isn't a race. The slower and more deliberate you are, the more your balance system is actually working. Second, people look down at their feet. Try to keep your eyes up and looking forward. That's closer to real-life walking conditions. And third, and this one's important, if you feel dizzy or unsteady, stop. This should feel mildly challenging, not dangerous. I had a patient, Margaret. She was 74, still very sharp, but she'd had 2 minor stumbles in her garden in the same season. She started doing this exercise every morning while her coffee brewed. 12 weeks later, she told me, with a kind of quiet pride, "I don't think about my feet the same way anymore." That's exactly what this exercise is training: confidence in motion. The second exercise is the single leg stand. This one sounds deceptively simple, and honestly, for a lot of people, it's harder than it looks, which is exactly why it works. Stand behind a sturdy chair and hold the back of it lightly, not gripping for dear life, just fingertips. Now lift one foot a few inches off the floor and hold it there. 10 seconds, 20 if you can. Then switch legs. Do that 3 to 5 times per side. What this trains is called static balance, your body's ability to stabilize itself when you're on one foot. Think about how much of daily life involves moments of being on one foot: stepping into the shower, putting on trousers, stepping over the garden hose, climbing stairs. Every single one of those moments involves a brief period where all your weight is on one leg. If that system is weak, those ordinary moments become risky ones. For beginners, keep your fingertips on the chair the whole time. As you get stronger, try touching the chair lightly with just one finger. Eventually, and this might take weeks or months, which is completely fine, try doing it with your hands hovering just above the chair, not touching unless you need to. Practice this once a day. Morning works well, right after you get dressed. The consistency matters more than anything else. Now, and I'm genuinely curious about this, how many of you have tried to stand on one foot recently and been surprised by how unsteady it felt? Leave a comment and let me know. Tell me your age too, if you're comfortable. You'd be amazed how reassuring it is to find out you're not alone in this. The third exercise is the sit to stand. Before I explain the technique, let me tell you why this one matters so much to me personally as a physician. The ability to get out of a chair under your own power is one of the single greatest predictors of independence as we age. I've watched patients lose that ability gradually over the years. First, they need a higher chair. Then they need to use their arms to push up. Then they need help from a family member. Every time, it happens slowly enough that they don't quite notice until one day they do. And by then, the muscles that should be doing that work have been quietly weakening for years. The quadriceps, the large muscles in the front of your thighs, the glutes, the hip flexors. These are the muscles that get you upright, and they respond well to training. Here's how to do this exercise correctly. Use a firm chair, not your recliner. Sit at the edge, feet flat on the floor about shoulder width apart. Lean forward slightly from your hips, not your back, and then stand up using your legs, not your arms. Try not to push off the armrests. Then sit back down slowly and with control. Don't just drop back into the seat. That's 1 repetition. Do 10. 3 times a week to start, and work up to daily as you get stronger. The controlled lowering back into the seat is just as important as the standing up, by the way. That slow descent builds what's called eccentric strength, the kind that actually protects your knees and hips during everyday movement. If 10 repetitions is too much at first, start with 5, or even 3. Where you start doesn't matter. That you start does. And now, the fourth exercise, the one I mentioned at the beginning, standing side leg raises. This one targets the hip abductors, the muscles that run along the outer side of your hips and upper thighs. And they are absolutely critical for one specific type of fall that most people don't think about, the sideways fall. Most people imagine falling as pitching forward or stepping off a curb, but a lot of falls, particularly in older adults, happen sideways. Your weight shifts to one side, and if the muscles that are supposed to pull you back don't fire fast enough, down you go. Hip abductor strength is what catches that. Here's how to do it. Stand behind a sturdy chair, holding the back with both hands. Stand tall. Try not to lean to one side. Now slowly lift your right leg out to the side, keeping your knees straight and your toes pointed forward, not upward. Lift it maybe 8 to 12 inches. Hold for a second or two, then lower it slowly and with control. 10 repetitions per side, 2 to 3 sets, aim for 5 days a week. The key mistakes here are leaning your torso to the opposite side to compensate, which takes the work off the hip muscle, and lifting the leg too high or too fast. Slow and controlled wins every time. I remember one patient, Eleanor. She was 79, and she'd fallen twice in the previous year. Not catastrophic falls, but enough to scare her daughter badly. Eleanor was determined not to lose her independence. She was still driving, still tending a small vegetable garden, still cooking Sunday dinners for her family. She started doing these exercises faithfully, every morning before breakfast. 6 months later, she told me, and I remember this clearly, "I feel like I have my legs back." She hadn't needed the chair for support in weeks. She was doing the raises freestanding. That's what consistency over time can do. A few additional habits worth mentioning quickly, because exercises alone aren't the whole picture. Walk regularly, even if it's just around the block. Daily walking is one of the best things you can do for your legs, your heart, and your mood. Stay hydrated. Even mild dehydration can affect your concentration and reaction time more than most people realize, and a lot of older adults simply don't drink enough water during the day. Wear supportive shoes inside the house, not just outside. Slippers with thin soles and no heel support are a fall risk sitting right there in your own home. Get your vitamin D levels checked. Deficiency is common in older adults and is linked to muscle weakness. And get your vision checked regularly. I've seen patients whose balance improved noticeably once they had an updated glasses prescription. Your eyes are part of your balance system too. Before I close, I want to say something important. These exercises are safe for most adults, but if you have significant knee or hip pain, recent surgery, severe dizziness, or a neurological condition, please talk to your doctor or physical therapist before starting any new exercise program. Use a sturdy support whenever you feel you need one. There is no shame in that. The goal is progress over time, not pushing yourself past what's safe. Here's what I want you to take away from today. Balance isn't something that simply happens to you as you age. It's something you can work at, gently, consistently, in your living room, in your socks, while your morning coffee is getting cold on the counter. Harold, the man I told you about at the beginning, he's a composite of patients I've seen over decades, but his story is real in every way that matters. And the truth is, many falls like his are preventable. Not all of them, but many. And even if we can't prevent every fall, we can absolutely reduce the fear of falling, improve confidence, strengthen the muscles that help the body recover from a stumble before it becomes a fall. That's worth something. That's worth quite a lot, actually. Which of these 4 exercises are you going to try first? I genuinely want to know. Leave it in the comments. The heel-to-toe walk, the single leg stand, the sit-to-stand, or the side leg raise. If you've already been doing any of them, tell me how it's been going. I read these comments. They help me understand what people are actually dealing with. And if this video helped you think about your health a little differently today, consider sharing it with someone you care about, a sibling, a spouse, a friend who's been a little more unsteady on their feet than they used to be. Sometimes all it takes is someone explaining the why behind the what. Come back and join us next time. We're going to talk about something that surprises a lot of people, a common morning habit that may quietly be weakening your legs after 70, and most people have no idea it's happening. You'll want to see that one. Take care of yourselves, and take care of your balance. It's carrying you through every single day.